What if the most dangerous sign of diabetes wasn't a sugar spike or fatigue, but a tiny itch behind your ear that everyone ignored? In the quiet tapestry of later life, where the days seem to slow and the body's rhythms gently shift, many changes arrive without fanfare. Sleep patterns alter, appetites wane or wander, and small discomforts become part of the everyday landscape. It's easy to chalk up every new sensation to just getting older. Yet within this subtle transformation, a silent adversary sometimes slips in. One that rarely announces itself boldly, but rather whispers through the body in ways easy to overlook. This adversary is diabetes. And in seniors, it wears many disguises. The challenge with diabetes in people over 60 is that it seldom acts like its younger self. While in youth, the onset may be sudden, marked by intense thirst, dramatic weight loss, or unquenchable hunger. In seniors, diabetes is the master of camouflage. Symptoms that would raise alarm in a younger person are often dismissed as benign quirks of aging. Increased trips to the bathroom at night? Surely the result of an aging prostate, or just drinking more tea before bed. Persistent dry skin? Must be the weather, or perhaps the body's natural response to the passing years. But these seemingly harmless changes may be sirens in disguise, quietly signaling a serious underlying shift in the body's ability to regulate sugar. Consider, for instance, the subtle craving for sweets. A person who's always enjoyed a balanced diet suddenly finding themselves reaching for cookies after dinner, or feeling an unusual desire for sweetened drinks, might not think twice. Yet, this could be the brain's attempt to counteract unstable glucose levels, seeking the quick energy it's missing. The body is resourceful, and when blood sugar is unsteady, it sends signals that can be mistaken for innocent preferences. Vision, too, becomes a tricky messenger. Blurry eyesight that comes and goes is often attributed to fatigue, aging eyes, or needing a stronger prescription. However, blood sugar that swings up and down can quietly damage the delicate vessels in the retina, leading to vision changes that may be reversible at first, but grow more permanent over time. Yet some of the most telling signs are even quieter. Mood swings, irritability, or a sudden sense of mental fogginess, especially after meals, are not just quirks of personality or the mind wandering with age. They are often neurological echoes of fluctuating blood sugar, which disrupts the brain's ability to function smoothly. The mind, intricate and sensitive, relies on a steady flow of energy. And when this is interrupted, focus, patience, and even memory can suffer. One of the most insidious symptoms, however, is the mysterious loss of muscle mass. In the normal course of aging, muscles do tend to shrink, a phenomenon known as sarcopenia. But when the loss is rapid, particularly in the arms or thighs, and doesn't seem to match changes in diet or activity, it can be a sign that diabetes is quietly at work. With insufficient insulin, the body struggles to access glucose for energy, turning instead to muscle tissue. This slow erosion of strength doesn't happen overnight, but its progression can be swift enough to notice, if one is paying attention. Then there's the often overlooked tingling or numbness in the feet. Seniors may blame poor circulation, but the first tendrils of diabetic neuropathy often appear before a formal diagnosis. Nerve damage starts subtly and, if ignored, can lead to balance problems, persistent pain, or even ulcers that heal slowly. What makes early detection even more challenging is the way traditional blood sugar tests can miss the creeping onset of diabetes in older adults. Fasting glucose levels might appear normal, offering false reassurance, while dangerous spikes occur after meals, when the body's ability to process sugar is at its weakest. The signs remain masked, hidden in the shadows of routine checkups and unremarkable lab results. Dry mouth, sticky tongue, or a parched feeling that persists, even with adequate hydration. These too are clues. The body's attempt to rid itself of excess sugar leads to more frequent urination, which in turn depletes moisture. It's a cycle that can leave the mouth feeling like sandpaper, a subtle but persistent reminder that something is amiss. Pay attention as well to wounds that linger, small cuts or nicks that do not heal as quickly as before, or infections that recur, particularly on the feet. The body's immune defenses are weakened by persistent high blood sugar, making recovery slower and more complicated. Other whispers are even more personal. For women, frequent yeast infections can be a sign of sugar excretion in urine, providing a perfect environment for yeast to thrive. For men, erectile dysfunction may precede other, more classic symptoms. These experiences are often kept private, unmentioned even to doctors, but they are important clues. Perhaps the most crucial lesson for seniors is that diabetes is a quiet thief, robbing vitality under the cover of ordinary aging. Fatigue after a short walk, a new urge to drink water without thirst, waking up in the night with unexplained anxiety, or a sudden loss of taste for foods once enjoyed. These are not just random events. They are the body's coded messages, asking for attention. The good news is that awareness offers power. By tuning into these early subtle shifts, by noticing the patterns behind the symptoms, seniors can take action long before diabetes becomes a dominant force. Regularly monitoring blood sugar, not just in the morning, but after meals, watching for changes in emotional stability, and being vigilant about skin health and healing can make all the difference. Imagine a world where seniors catch diabetes months or even years before traditional testing would ever find it, where they listen not just for the body's screams, but for its whispers. In that vigilance lies the chance to preserve independence, health, and the rich joys of aging well. The body is always speaking. It's time to truly listen. The early signs may be quiet, but they are the warning bells that offer a second chance, an invitation to age with grace, strength, and wisdom.